failure to see this whole model in context when we look at COVID has detrimental effects. And an example is here where I live. We had leadership who made a comment that, our numbers are rising because people are, one, not staying home, and two, people with very large families are still having gatherings, meeting at each other's homes. And this leader singled out a specific ethnic community, saying they have large families and they are contributing to why our numbers are rising. And if you look at the city where I live, a certain area of the city has higher numbers, and this area of the city with higher numbers has a lot more racial diversity. And so it just kind of singled out this ethnic group and just racialized people in general, saying that they're the reason why COVID's going up. They're not staying home. They're not following the rules. And it was like, whoa. If we look at the socio-ecological model.
This is the Public Health Insight Podcast. Before we move on, it is important to note that the views expressed in this podcast are our own and do not represent any of the organizations we work for or are affiliated with.
In our previous 2 episodes, we introduced the Socio-Ecological Model as a cornerstone of public health practice and health promotion. A basic understanding of the Socio-Ecological Model is crucial for identifying reasons why public health issues such as COVID-19 disproportionately affects some populations. This episode brings our discussion full circle as we use COVID-19 as a case study to apply the principles of the Socio-Ecological Model. In terms of the Socio-Ecological Model, there are other real-world examples of applying this model to various public health issues, such as, in environmental action, promoting vaccines, which is a very hot topic lately, physical activity, nutrition, oral health, diabetes, you name it. But one thing that's very real now, amongst the other things that are also very real in terms of public health, is COVID-19. So we want to walk through kind of COVID-19 as a case study of how to apply the socio-ecological model, just to give people an understanding of. There's a lot of news right now, for example, about vaccine hesitancy in like the Black community, and people might be struggling to relate to that situation because maybe in their ancestry there was no historical oppressions and that nature. The socio-ecological model, like we said, allows us to develop an understanding of the unique context behind each population and how that influences their decision making and their ability to be healthy. So we're going to use COVID-19 as a case study to apply the socio-ecological model, starting with the individual level. So let's talk about some of those individual level sphere of influences and some examples related to COVID-19.
So when I first look at, COVID and individual level, I think a lot of our prevention policy is here. Wear a mask, choose to stay home, social distance. It's you. The onus is on you as an individual to, personal hygiene, to make those choices so that you don't get sick and you don't get other people sick. And I mean, it's effective to a degree, but I have critiques, but we can keep going.
Yeah. Another factor would be, I guess, the individual's biological or genetic makeup. Do they have chronic conditions that may make them more susceptible to contracting COVID-19?
As well as individual health literacy. And I think that also comes in the form of whatever information is available to the individual. Is it available in a language that's easily understood? So it's not using a lot of scientific jargon, not using a lot of big, smart sounding words. And also, is it available in a language that the person can just understand at all? It's like if the individual can't understand English or French, then what's the use, even having very easily understood documents if you can't get the message across?
Right. Even for you talk about too that the medium in which it's presented. So we talk about the visual impaired and hearing impaired. The visual impaired, if they're not able to read resources, and then the website doesn't have accessibility built into it, read out loud features, maybe they're not able to access that information.
Yeah.
And I wanted to also touch on Linda's example. So mask wearing, in terms of the individual level factors and individual level sphere of influence and self-efficacy, is also influenced by interpersonal. So do the friends that you're supposed to or you're not supposed to be hanging out with during COVID, are they wearing masks? Is it a norm within your group to wear a mask? So maybe you would wear a mask on your own, but you're influenced by your peers to not wear the mask because they may or may not believe it either works, or if COVID-19 is real, which then influences your decision whether you will wear a mask while you're hanging out with them. So that's another key part of the interpersonal level sphere of influence.
With interpersonal, let's say you live in a large family household, and so like trying to social distance from your family, that may not be possible. But what if, let's say you live in a large family with people who are at higher risk to contract COVID, maybe through their work exposure. And so then you may contract COVID from someone who works, as an essential worker, and you didn't do anything wrong, right? But it's just your interpersonal environment is what led to that. So, that's a factor.
Yeah, but then on the other hand, these like vulnerable individuals within these families have, say, a stronger interpersonal and relationship conditions, and that helps them in terms of accessibility to vaccines, like health measures to counteract COVID-19. And for example, say if there's material out there that talks about how to, personal hygiene and all that, and say it's inaccessible to the person, if they read it firsthand, well, their social network or the family would help them out with that. So it would be more accessible to them.
Another thing for that too is in those, I guess, multi-generational households is what they would call it. We know that social isolation and loneliness are a key public health issue that stems, prior to the pandemic and even more so now. So maybe families in those situations, though they're subject to things like overcrowding, which is a risk factor for COVID-19, may also be protected from the secondary health issues that result from COVID-19, in that they do have social supports that are easily accessible. But I also want to touch back on the individual level sphere of influence, where we touched on it earlier. Gender is an individual level sphere of influence, and we know that essential workers are most likely to be female. So if we have a situation where in COVID-19 females are disproportionately likely to be working in essential roles that are still going on because of the pandemic, their risk for contracting the disease is higher, and then there's a susceptibility there from dying from the disease. So we can see then that individual level factors are influenced by the policy level, the decision to allow only essential work to be open, and there's that bi-directional relationship there as well.
Yeah, as well as gender-based violence as well.
Definitely, with staying home. And another individual factor is like immigration status, and that could also tie into policy. But in Alberta anyway, a lot of newcomers are having higher rates of COVID due to a higher number of newcomers are essential workers and work in working conditions that may not be as safe. So that could also be institutional.
Absolutely. And moving to organizational practices or the organizational or institutional sphere of influence, one thing that comes to mind is if you work in an industry where you have the ability to work remotely, so your risk of getting the disease might be lower than someone who has to actually physically report to work and be at a higher risk of exposure. So that's how the institutional level can influence your ability to be healthy as well.
In terms of organizational, institutional, if you have paid sick time, that would influence if you will stay home if you feel unwell versus going to work and potentially infecting others.
Yeah, and another thing with the institution and organizational level, even though there's policies at the higher levels of the spheres that are influencing some of the rules and internal policies that they make, the application and actual practicality of implementing those policies vary widely between organizations, whether it's a small business or a larger corporation.
Even within organizations that, let's say you have two companies or two organizations where they are deemed essential and you have to come work in person, how they make the space safe and what regulations and rules are in place to ensure the safety of the employees, that it can vary a lot between the two organizations, and that can have a lot of an impact on the safety and wellness of the workers.
Exactly. And in line with LaShawn's example about policies being set at the, provincial or regional level affecting institutional policies, one thing that comes to mind is under the Occupational Health and Safety Act, there's the requirement for a medical note when someone has to miss work for the purposes of illness, I believe has been waived indefinitely because of COVID-19. So if the work environment or the institution puts up barriers for these individuals who need to miss time off work, even though there is a overarching policy, that can also make the individual's life difficult as well.
Mm-hmm.
Yeah, and another thing with this is, there's two things at least that I want to bring up for this as well. The first would be, now that certain organizations and institutions have access to vaccinations, how are they going to distribute that in, an equitable way? And I guess
that's an episode all in itself, eh?
No, for sure.
Yeah.
And I guess the other thing, due to the burden of COVID-19, health staff are now having to make the decisions about how to prioritize different equipment, such as ventilators, and what are the policies behind that to make sure individuals get the help that they need.
And even mental health support for a lot of frontline workers, hospital staff at the institutional level. Burnout is so real right now. Seeing people die, it's like, how do you keep going? How do you stay, motivated to do your job?
There's example of where failure at the institutional level happens, say in Egypt. So a hospital that had a lot of COVID-19 patients on ventilators, and that was the situation until one morning, the hospital ran out of oxygen. That failure led to a lot of unnecessary death in the hospital. If you search up, it hits you on the emotional level.
The organizational's failure led to these preventable catastrophes.
This is very disturbing, but it becomes even more disturbing if we factor in that certain groups are disproportionately more likely to get sick and hospitalized from COVID-19 and therefore require ventilators to survive. So if this action or error led to the disproportionate death of certain groups, it's even more tragic than just, the overall running out of oxygen.
Because that's like a public hospital. I mean,
exactly.
Yeah. So that's more dedicated to people who are on the lower
socioeconomic status.
Mm-hmm.
Yeah.
Right.
Yeah.
Exactly. And one thing, just to answer LaShawn's question too, the government of Ontario does have a framework for equity for distributing the vaccines, which is factored into their decision making on prioritizing different populations. As a side note, at the community level, we know that small businesses are disproportionately affected by COVID-19 due to the restrictions in place that have led to their closures. And we know there's a lot of kind of grassroots things going on right now, encouraging people to, if they are to get takeout, to buy from these smaller businesses in terms of restaurants, in order to support them through these difficult times, because they have less access to financial resources to stay open compared to maybe the more franchise-related businesses.
And I think there's broader implications to COVID-19 and its effect on the community. If we consider that individuals also play part and make up a community, if these individuals are interacting less often physically and with different events that are going in the community, there's going to be some sort of breakdown in sort of that camaraderie and that community building aspect of this. So we don't know what the implications of that is currently, but that's just something to consider when we're thinking about these different things.
I think that's an awesome point, LaShawn. And I think it's, even factoring, let's say, you have a really close-knit community and one member of the community unfortunately passes away from COVID. What kind of impacts will that have on the rest of the community? Someone who's been maybe there for 30 years or plus, or even just it has almost gotten to a point where you almost blend community with the interpersonal, right? And that aspect coming in.
Exactly. And if you consider the fact that that individual that may have died from COVID was a really prominent member and really rallied up the community, it could be devastating.
Or not being able to mourn together. Having
Exactly.
to be isolated.
Oh my gosh, yeah.
Something I wanted to mention with community, going back to the built environment side of things, is, even things like how the community is planned and designed and what resources it has. So, in Canada, at least, and in Ontario, and I'm sure in Alberta as well, Linda, the government, although they are issuing lockdown orders, they are still encouraging people to go for wellness walks, go outdoors, exercise, things like that. And for me personally, I'm very privileged, and I live in a community where we have a lot of trails, a lot of green space to engage in these activities. But if you're an individual who lives in an environment that's not conducive for these activities, that not only affects your physical health, but things like your mental health as well is going to be impacted. And then along those lines, it's the same as I currently live in with my parents in their home. It's a lot of space. It's enough. But let's say you're living in smaller, cramped, not the safest, not the most optimal housing, and you have in very close proximity with other individuals, that not only increases your risk of contracting COVID, but also it can lead to other mental and social psychological impacts as well.
Great point.
Absolutely. And there is, in terms of the apartment buildings, living in close quarters, there is I can't tell you exactly where it happened, but there is a building that had a COVID-19 outbreak in a residential building, because obviously it's close quarters. The ventilation might not be as great, especially now when you're not able to open your window because it's too cold. Mm-hmm. So it does have a real impact too on the COVID-19. It seems like a far-fetched example, but it literally has real life implications.
And even last year, when COVID first started, so I was living in Ottawa, in my other condominium place, right? And there it was usually people have access to the gym, but with COVID the gym is closed. So for a lot of people, that's one form of exercise or physical well-being that's kind of taken out of the equation. And then also I remember when I was there during kind of the peak of when COVID first started in Canada, even just going out to get groceries, I felt like I was putting myself at risk, because I'm not only, when I step outside of my unit, it's I'm exposing myself to the world almost, right? And then going down the stairs, down the elevator, through the different sets of doors, and then trying to come back in with all this food. I definitely felt like it had a more of a psychological and mental impact on me, and just a lot of strain in that sense, rather than the physical side of things.
Absolutely. And just that's a good segue into kind of the bigger picture of tying it all together in terms of the societal and policy level sphere of influences. So in Canada, we're privileged in that, for the most part, we do have a universal healthcare system, so that if someone is hospitalized because of COVID-19, they're less likely to be financially impacted outside of missing work and stuff like that, which does impact someone's income. Where in other countries, in the United States, it's unclear there's stories about people being on ventilators for 1 or 2 months. So in terms of a medical bill in a jurisdiction or country where universal healthcare doesn't exist, what does that mean for them and their families, right? And another thing I wanted to touch on, just to close it off, is we talked about how there's that gender component to COVID-19 where females are overrepresented in the essential workforce. So therefore, things like childcare policies are important. So there's a concerted effort in pretty much all levels of government to support women who do have children, in that they're able to go to work, feel and have safe childcare for their children. So that's another way we can see how societal level influences can influence decision making and ability to be healthy.
Failure to see this whole model in context when we look at COVID has detrimental effects. And an example is here where I live. We had leadership who made a comment that, our numbers are rising because people are, one, not staying home, and two, people with very large families are still having gatherings, meeting at each other's homes. And this leader singled out a specific ethnic community, saying they have large families and they are contributing to why our numbers are rising. And if you look at the city where I live, a certain area of the city has higher numbers, and this area of the city with higher numbers has a lot more racial diversity. And so it just kind of singled out this ethnic group and just racialized people in general, saying that they're the reason why COVID's going up. They're not staying home. They're not following the rules. And it was like, whoa. If we look at the socio-ecological model, we could see that this certain group that this leader was talking about also makes up a large amount of the essential workforce. And so perhaps the reason why COVID is higher amongst this community is maybe a more on the institutional level, that the workplaces are not providing adequate PPE, for example, or it could be a failure on the part of community at the community level, where limitations in transportation, for example, so people have to carpool to be able to get to their work, or even failures at the policy level where it's not made possible for people to stay home because the benefits are not as accessible. And so the blame was on the individual and interpersonal. But all these other levels were missed, where, a lot of blame could go to our leadership for not acting on these more outward levels of influence and for only putting emphasis on individuals. And I thought that was very disappointing in our leadership, because did you look at a socio-ecological model? Did you see that it's not just the individual? There's so much more to an issue. And that could influence stigma, to just say it's the individual's fault. That was disappointing.
The socio-ecological model has been widely adopted in public health, and an understanding of this framework is essential for becoming an effective public health advocate and practitioner. We want to find out from our audience of public health practitioners at various stages in their career, how do you apply the socio-ecological model in your work? What are some success stories or challenges you've experienced while incorporating this model into your work? Message us through our social media or by email. We'd love to hear your thoughts. My name is Gordon, your host for this episode, signing off.
Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our content and would like to stay up to date, follow us on Instagram, Facebook, Twitter, and LinkedIn. To learn more about our community initiatives and how you can support us, visit our website at thepublichealthinsight.com. Join the PHI community, and let's make public health viral.